Living with hemophilia B is not to please anyone else, yet to please yourself, so that at the end of the day, you can sit back and be comfortable with all of who you are. I was diagnosed at approximately the age of 6 months old with hemophilia B. I have less than 1% of clotting factor in my blood. Hemophilia chapters started to have summer camp programs for youth with bleeding disorders. It was to build community and to normalize your bleeding disorder. I felt as if I was understood. In my early teens, I found out that I was HIV positive from blood products. I had the summer camp community to turn to. You can pick up the phone and call a blood brother or blood sister with hemophilia B, and you can have true connection. I vowed to give back to community, and I became an advocate for those within the bleeding disorders community who felt marginalized. When I was in the clinical trial with N9GP, it was a very positive experience from reconstitution, administration, and documentation. At first, I was trepidatious because I had never been in a clinical trial before. After 2-3 conversations with my healthcare professional, I was comfortable. It's important to have an extended half-life treatment for those on-demand bleeds, number one. Number two, that the product will stay in your system longer. Everyone with hemophilia B is different and unique when it comes to their treatment. It's all about appropriate choice and having that conversation both with your support system and your healthcare professionals of what works best for you. Choice can be the simplest thing as independence or non-independence. Choice means you can have an active voice in your care.
Indications and usage. What is Rebinyn coagulation factor 9 recombinant glycopegylated? Rebinyn is an injectable medicine used to replace clotting factor 9 that is missing in patients with hemophilia B. Rebinyn is used to treat and control bleeding in people with hemophilia B. Your healthcare provider may give you Rebinyn when you have surgery. Rebinyn is not used for routine prophylaxis or for immune tolerance therapy. Important safety information. What is the most important information I need to know about Rebinyn? Do not attempt to do an infusion yourself unless you have been taught how by your healthcare provider or hemophilia treatment center. Carefully follow your healthcare provider's instructions regarding the dose and schedule for infusing Rebinyn. Who should not use Rebinyn? Do not use Rebinyn if you are allergic to factor 9 or any of the other ingredients of Rebinyn, are allergic to hamster proteins. What should I tell my healthcare provider before using Rebinyn? Tell your healthcare provider if you have or have had any medical conditions, take any medicines including non-prescription medicines and dietary supplements, are nursing, pregnant, or plan to become pregnant, have been told you have inhibitors to factor 9. How should I use Rebinyn? Rebinyn is given as an infusion into the vein. Call your healthcare provider right away if your bleeding does not stop after taking Rebinyn. Do not stop using Rebinyn without consulting your healthcare provider. What are the possible side effects of Rebinyn? Common side effects include swelling, pain, rash, or redness at the location of the infusion, and itching. Call your healthcare provider right away or get emergency treatment right away if you get any of the following signs of an allergic reaction: hives, chest tightness, wheezing, difficulty breathing, and/or swelling of the face. Tell your healthcare provider about any side effect that bothers you or that does not go away. Animals given repeat doses of Rebinyn showed polyethylene glycol, PEG, inside cells lining blood vessels in the choroid plexus, which makes the fluid that cushions the brain. The potential human implications of these animal tests are unknown. Please see link below or a Novo Nordisk representative for prescribing information and instructions for use. Rebinyn is a prescription medication. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.